the 62nd Airlift Wing Commander, Colonel Aaron Stainpine, our hospital commander, Colonel Tom Bunt, and other experts here ready to respond to your questions. What I would like to address first is the general order that was published on March 25th and explain what it means. The general order was implemented to specify what soldiers and Department of the Army civilians on JBLM can and cannot do while we're aligned with the governor's stay-at-home, stay-healthy proclamation here in Washington State. This general order is not intended to restrict service members, civilians, or their families' access to and from JBLM or restrict others from accessing JBLM for essential goods and services. This general order is about preserving the force. For example, anyone not ordered into quarantine or isolation may go off post. But keep in mind that Governor Inslee has also put out a stay-at-home, stay-healthy order, so you should only go off post for essential goods and services. There are also no current restrictions to visitors coming onto JBLM for essential services. However, visitors that do come to JBLM need to abide by our current COVID mitigation measures, specifically physical distancing by 6 feet, cleaning what you touch, hand washing, etc. I'm asking our community to be mindful of their neighbors and apply individual discipline here. Other installations have taken more restrictive measures with civilian visitors. I'm counting on all of us to do the right thing so that I don't have to take more restrictive measures here on Joint Base Lewis-McChord. Over the past few days, we've had a slight increase in the number of cases on JBLM. I'd say we're doing just okay right now, but the disease has continued to hit higher numbers in our local communities. Again, our personal discipline is critical to stopping the spread of this disease, and I appreciate everyone's continued vigilance. Last night, Governor Inslee extended his stay-at-home order through 4 May, and therefore, I too am going to maintain the protection measures we are now under through the 4th of May. Let's make April the month that we stopped COVID. In the meantime, commands and staff across JBLM are planning on how we will return to normal operations after COVID. There will obviously be some impacts to our training and maintenance schedule as well as our daily operations. I urge all of you to take the initiative to maintain the highest level of individual readiness you can right now under the current conditions. Do good PT, eat healthy, rest up, study to become an individual expert at your MOS or grade level. If you want access to study materials, we will help you find them. And I'll also ask that you share what you're doing with your buddies so we can all learn from each other and challenge each other. For those soldiers and families who continue to live in PCS limbo, please know that the exception required for you to move still rests with the Vice Chief of Staff of the Army. We usually hear back on these exceptions in about 7 days. Next week, we will begin hosting a series of targeted town halls, and one is specifically focused on PCSing. I also expect that each one of you that are out there in this status has been contacted by someone in your unit and an expert on the garrison team to touch base and make sure that we are aware of the situation you are dealing with. If you have not, Sergeant Major Pospisil and I want to know. Please call my hotline at 253-967-3831. We also have out on the top of up in Facebook, it's also on the website, a list of targeted town halls. I mentioned these when we got together on Tuesday, and there's several subjects that are on there. As I mentioned, Exceptional Family Member Program is on there. If you're getting ready to have a baby, there's several that will happen over the course of the next couple weeks, targeted town halls, and we'll be increasing that as well. So if it applies to your specific family situation, I encourage you to watch and participate so we can get better, more targeted answers to any of your questions. And again, any of these areas, if you don't feel like you're getting the assistance you need, call my hotline at 253-967-3831. 631. I also want to mention to all our families that even though our food courts and shopettes are open for to-go options, JBLM also has some good, healthy takeout options available as well as at our Warrior restaurants, formerly known as dining facilities. I'm very serious about making our dining facilities a first choice for our soldiers and family members. I came in the Army as a private, didn't have a car, lived in the barracks, and I like to eat. We're going to have the best chow halls in the Army here at JBLM. I highly encourage you to grab a to-go box and give us some feedback on how we're improving. Information regarding the location, hours, and prices is available across our social media platforms. Our JBLM MWR Facebook page also has a list of resources available for you to maintain an active and healthy lifestyle, keep your kids busy and learning, and ways to manage stress during this time. You do not need a Facebook account to access the information. You may also view this information from the JBLM website by clicking on the red COVID-19 Impacts on JBLM button and then selecting Resources for Affected Families. If you have an idea on how we can better deliver information and services to you, please share them on our social media platforms so we can provide you a better product now and into the future. We're working to expand our reach so everyone who lives here and works here is hashtag JBLM Sound Living. Okay, we're ready now to take your questions. Okay, first question is from Neil. Are some soldiers deployed due to COVID? Will more soldiers deploy on COVID-related missions? So we do have soldiers right now that are out helping in the local community up at CenturyLink Field, setting up the hospital that are up there, as well as many of our logisticians that are helping to support it. We have some units that have actually been told to prepare to potentially deploy, and if we're asked to do these missions and obviously ordered to them through the Department of Defense and the headquarters of the Army, we will certainly do our mission. Okay, next question, and Sergeant Major and I think of several of us will answer this. Next question's from Brian. Are service members authorized to wear a mask? I'll let you answer that one, Sergeant Major.
Absolutely, sir. All right, so yeah, we did field a few of these today, and the commander and I talked with each other about it. And I'll tell you what you can do is if you feel that you need it or if it's required, you can wear a mask. I just ask that you use good judgment, both in size and in color. Make sure there's no logos, symbols, nothing inappropriate or derogatory on the masks. And I'll also tell you that the Department of the Army, right now, as we sit here, is working on their policy on the uses of masks.
Okay. While we had the question on the masks, I would, because I read what Dr. Fossey that put out, I think, at the national level, and I'd like one of our docs to come up again and just talk to us again about masks so that we're all aware.
Right. Thanks, Ryan, for the question. So amid new data from the CDC and several other sources, a lot of information is coming out about this condition. And so what that really entails is more information about the asymptomatic and pre-symptomatic stages. Before we really know we're actually infected, we could be spreading this to other people. And so on open source media this afternoon, it was released that the CDC does support the use of cloth masks. That's more or less to prepare or to prevent the spread of that virus to other individuals unknowingly by yourself, for instance. It doesn't really protect you as the wearer. It's also really important, and this is one of the main points that I wanted to bring up today, is that this does not prevent or replace what we know as social distancing. So it's really important to still continue with what's already been described this afternoon, keeping about 6 feet in front of, away from the folks that you're with. Those are essential, as well as essential hand washing, thorough hand washing for about 20 seconds at a time, in concert with social distancing, in concert with this cloth mask, can be very helpful in reducing the spread of this condition.
Okay. Thank you, Doctor. Next question's from Tom. It says, why are soldiers outside the McCord Commissary not wearing masks? We've actually talked about this. I think they will be wearing masks. Again, they should be maintaining physical distance, but we will put the soldiers that are out there on duty for their protection, for everybody's, we'll have them wear masks. Okay, next question is from Danielle. Why is the Lewis Commissary bagging your groceries and placing them in the cart of the person in front of you? Colonel Duncan, you want to come up and take this one?
Thank you for the question, Danielle. We've worked with the commissary, as you know, and AFES as the exchanges. And again, I'll just reiterate that these are mission critical capabilities for us, and we will keep them open. And in that vein, the baggers, the checkers and the baggers, you've probably seen some plexiglass shields that have gone up in the past week at the AFES facilities and soon to be in the commissary facilities as well. That's to protect the checkers and the baggers and you. And then they are washing their hands in between the interactions, in between bagging your groceries and the next person's, and they're sanitizing the carts as well. So while the carts are continuously cycled through the commissary, they are sanitizing them, and when you walk in, they're also, I know, handing out sanitizing wipes for you to sanitize your own cart as well. So we have all the right pieces in place to make sure that while we keep these facilities open to provide food for your family, we're also doing it in a safe way. Thank you.
Okay, and I know we're very blessed here with the medical staff here, preventive medicine from Madigan, who constantly will help us look at the areas on post here on the base, and we will continue to do that. And again, I've asked some questions because I know that there's several areas. I think that on the base here, when you come to the commissary, that we're taking probably extra precautions that you're not seeing in most other places. There's probably some that are out there, but we'll continue to do this and refine and get better wherever we can. Okay, next question from Tatum. Says, is there a way to enforce times reserved for elderly and high risk? Colonel Duncan.
Thank you, Tatum. I think we probably mean at the commissary with this question, which is where we do have the specific hours set aside for the elderly and the higher risk population. As far as enforcing them a little bit more strict, I thank you for the question, and we need to look into this a little bit more to ensure that we're enforcing it. We will double check that, and more to follow.
Thanks, Guy. Next question's from Samantha. Due to the state's extended stay-at-home order, will JBLM extend its minimal manning? Yes. As I mentioned at the opening, we will extend I've extended it in line with the governor for our minimum mission essential and the general order until the 4th of May. Next question's from Eric. Recently, the tank bridge was closed by range control, denying access to Eastgate from Yelm, Rainier, and Torino. When will it reopen? We're not changing our gate posture. Everything's going to stay the same through the 4th of May. So what we have right now for gate posture, I don't know if you want to comment on that.
That's affirmative, sir. Right now, that gate is closed, and it will remain closed until we change from the 9 gates back to our original 13 gates.
And then, again, to remind everybody while we're doing that is we have MPs that we are using for many other missions. We're trying to reduce the number of soldiers, obviously the minimum mission essential. We've probably seen a 55-60% reduction in the amount of traffic. Because of that, we don't need as many gates open. And we were very careful about what gates we closed. You still have very easy access to the post through 9 gates. So I think we're in good shape. Next question is from Jared. Is it true anyone coming back onto JBLM will be reported to their chain of command? Okay, no. I mean, we're probably talking here coming back at midnight or 1 o'clock in the morning. And Jared, I don't know what kind of essential services you're getting out there at midnight or 1 o'clock in the morning, but certainly no one is reporting anything to me. You have any comments on that? Sorry,
No,
Major, you
again,
didn't-
this goes back to the social distancing, the general order, and soldiers and family members abiding with what your general order said and what Governor Inslee's order said. Stay at home, stay healthy, and if you're getting essentials, if you're going to and from a location, if you're out hiking, biking, or running, keeping your social distancing, there shouldn't be an issue. Over.
Okay, next question's from Dawn. Will non-essential service personnel be required to submit leave? The answer to that is no. They will not be required to submit leave. Okay, next question from Shavilla. Is the tax center closed? Okay, I know that the answer to that's no, and I also know there's been an extension to the tax filing deadline. Colonel Duncan.
Yes, sir. There, as you know, the federal government has extended the tax center guidelines, so you have a little bit more time. The tax center, however, is manned with military manpower, and that is given to us. The systems that they use are DA level systems, and it's military manpower that runs those. So what we ask is please call before you go, and here's generally how this process works. Call, make an appointment. When you go in for your appointment, you will hand them all your paperwork. They will do all the paperwork, and meanwhile you'll sit in your car. They will call you when they're finished, and you'll come in and sign the final paperwork. That's basically to allow the social distancing while they're doing all your paperwork. And of course, you'll be right there in case you have any questions back and forth on the phone with them, and then they'll finish your taxes for you.
Okay, don't go too far, Colonel Duncan.
I'm ready.
Next question's from Justin. Are retirees' moves being affected?
No, thank you for the question, but no, right now they are not being affected. We have 364 retirees and personnel ETSing this month. We know each of them by name, and none of those processes are being stopped right now. We appreciate the clear guidance. This was a little murky, I understand, for a little while there, but we've gotten some very clear guidance down from Department of the Army and Department of the Air Force that have allowed these processes to continue. So if you need help, please come to Waller Hall. We stand ready to assist.
Okay, next question is from Beth. And the question is, will Madigan prenatal classes be live or online?
Thank you for the question, Beth. Those classes will be those will be online. They could be through several different appointment mediums, and I would encourage you to look at the Madigan website for the latest clip. We just actually did one. I think it should post either today or tomorrow, actually Monday, and it talks specifically about all the different things we're doing for pediatrics, prenatal, and all that. And we're going to have a focused, as the CG had mentioned, Facebook or virtual type of medium where we can talk specific about pediatrics, EFMP, OBGYN services, the whole kit.
Okay.
Yes, sir.
Again, those targeted town halls are posted on the website. It's also should be hung at the top of the Facebook. And if there's obviously interest. What we're trying to gauge is interest that we have for questions. If there's there's something else that we need to cover specifically, then we will certainly do that. I know Colonel Duncan had brought up, help with moving. There's other things that we're going to continue to do these over because these topics will change, and we'll try to be responsive to those needs and requirements. Okay, next question is from Aaron. At what point will Lincoln start taking care of homes again? So I'm going to ask Colonel Duncan to come forward, but again, I put out if there's something, before even Colonel Duncan mentions anything, is something that's specific that is not happening, to be your taking care of your home, then I would ask, one is that there's an expectation that your chain of command is going to get involved. And if that's not working, I gave you the hotline number, and I would expect you to call it because we want to fix those problems.
Mm-hmm. Yeah,
Colonel
thank you
Duncan?
for the question. Right, Lincoln is still continuing work orders, so I'll just reinforce what the CG mentioned. Please let us know if that is not happening. However, they are not doing every routine work order. In order to focus on the life, health, safety, and the urgent work orders, if it is replacing a light bulb, they might leave it on your porch, and they'll communicate with you. They might leave it on your porch and ask you to do that light bulb just to keep down that social distancing. Much as you know right now when you get food deliveries, a lot of them are leaving on the porch and stepping back, and you might trade a tip or something like that. not saying that you tip Lincoln employees, but I'm just saying that that's the way that's the way we are interacting right now in COVID times. So there might be some things that very routine, low-need work orders that they are delaying right now, but they will communicate with you to let you know that that's been delayed, and they will get to it after we get through this. But if it's urgent or life, health, safety, they're absolutely continuing those work orders. Please let us know if they are not.
Thanks, Guy. Okay, I got two related questions. I'm going to ask the Madigan commander to come up. First one from Scott says, can retirees use the pharmacy? Second one from Katie asks, will Madigan experience a shortage in medication? Will I still be able to get medication from the pharmacy?
Okay, so first one for Scott. Yes, we still have retirees come into our drive-through only pharmacy lane. We have two options for the pharmacy. You could do the drive-through lane, or you could use eScripts or a network pharmacy. And I know there's some messaging out there of other locations, and it's commander's discretion whether or not to have the retirees get their medication on the economy. I still have it open where the retirees can come to our location through our drive-through or one of those other two options I mentioned. The other name was, I'm sorry, sir.
Retirees, Katie.
Shortage
Shortage
of medication. Yeah. At this time, we don't foresee a shortage of medication. I mean, I will tell you that there is that caveat that national shortages of any kind of particular medication, not those that are specific to any particular illness, but are those in high demand, occasionally do run short, or there's switches to generic. But overall, based on this crisis, I don't have any reports that there's any issues with any medication inventory shortfalls. And as a real quick, if I could, sir, I know we were talking about peds and prenatal visits earlier. This is how these things are magical. We do have already a video clip up on the website. My team, my PAO team, which are phenomenal, already put that together that we just filmed just yesterday, and it's already up there, and it gives you a lot of great information, hosted by Dr. Studer. And again, on the 8th of April, they'll have the OB and the EFMP discussion for the focused targeted groups like the CG was talking about. So hopefully that helps you.
Good. Thank you, Tom. Okay, this next one's from Stephen. Can you update us on the gym situation? Yes, and I guarantee there's no one more disappointed than me to not have the gyms open. We are shutting down the gyms. It will be in line with the instructions, the mitigation measures that we're taking until the 4th. We get that from we got people that are afraid to go in the commissary, which is a necessity, and we're concerned in the gyms, and so they won't be opening until the 4th. What I am looking at doing, and just to kind of preview what the Sergeant Major and I have talked about, is that eventually, when we get started, that we may open up the gyms initially to active duty ID card holders only, when we can start doing this, to kind of keep the numbers down. So as I mentioned, on Tuesday, and was kind of saying up front, this won't be a light switch when we go back, but we will figure out how to get things started back up. Okay, next question is from Jordan. I'm living in Northwest Adventure Park, waiting on post housing. Can I get an extension? Will I be able to get in house before the end of May?
Thank you for the question, Jordan. Yes, if you are living in one of our RV parks, either Northwest Adventure Center or the one on McCord, then yes, if you please give us a call, let us know the reason you need an extension, and we will extend. We are not taking any new reservations right now, and we are not extending for people who are traveling through on sort of vacation, because clearly the governor's, again, as the CG mentioned, in the support of the governor's proclamation, that would not be something we want to do. But if you're waiting for a house, that's relatively easy. Please give us a call, and we will extend that.
Thanks, Guy. Okay, next question from Skylar. It says, is Waller Hall still accepting appointments? My appointment was canceled.
I'll take that one too. Yes, Waller Hall is absolutely still accepting appointments, and I apologize for your particular appointment if it was canceled. Please try again, or if you want to get a hold of us, it depends on what the appointment was for. It could have been during the time that particular employee that does that thing that you needed was transferring into maybe a telework status, but all of those capabilities are either in person in Waller Hall or have telework capability where you call a phone number and they will help you. All of our capabilities are absolutely still accessible, and I apologize for that canceled appointment. Please try again and let me know, or get back on Facebook and let us know if you're not able to get through, and we will ensure we take care of you.
Yeah, and I appreciate that, sir, but I would tell you, so for anybody out there that had a canceled appointment, I would just ask you that, one, retry, like the garrison commander said, and if you're still struggling or your appointments are being canceled again, I would ask you to go through your chain of command, and if that's not working or you're not getting the answers that you think you need, again, call our hotline, and the CG and I will, we're going to get to the bottom of that, because we don't expect soldiers' appointments to be ignored. There will be some cancellations, and a lot of people are teleworking, and we want to get back to you.
Okay, next question is from Hao Lee. Does Madigan still accept PPE? Who do I call to donate?
Hawaii? Is that what you said, sir? Hawaii? Oh, Hawaii. Good question. We do, but we're actually pushing this through FEMA. So FEMA is coming up online, and the Federal Emergency Management Agency is basically running that mission up north that we talked about with the field hospital to support our sister city up here in the state of Washington. And I would ask that for that particular piece, you go to the website for FEMA. It's www.fema.gov/COVID-19 offers. And they are taking all PPE contributions and donations. We figure that's probably the very best way to give back to the system that's supporting the soldiers and the civilians out there.
Thanks, Tom.
Yes, sir.
Okay, next question's from Heather. Will the Army issue masks? Right now, no. We're not going to issue masks. We do have some very innovative and creative soldiers that are over in First Group that are making some masks right now. But again, the priority for that has been over to assist what we need in our own medical department, to assist with our flight crews that might need to wear it, and so then we will have priorities for those. So if we feel like someone needs to wear a mask in the performance of their duties, then we'll make sure that they get one. Okay, next question is, and Aaron will need you on this one, from Dylan. Is Air Force minimal manning extended to 4 May as well?
Thanks for the question, sir. We are extended minimum manning until at least 4 May. I put out a statement that said we'd be minimal manning until further notice. I am expecting that we are probably going to go longer than 4 May, but right now 4 May is a good target. Thanks, sir.
Okay. Yeah, and it's hard, as Colonel St. Pine suggested here, it's hard to pick a date. We're staying in line right now. You know, for all of us, it's looking at the trends and what's going out in the communities. 70% of our community here at JBLM lives off the base. And so as these orders get extended here as well with the governor, we'll certainly be in line, because it's for our safety of not only our soldiers, but our families and our communities. Next question's from Vincent. How are we supposed to clear SFL TAP if they're not answering the phone or emails?
Thank you, Vincent, for the question. I will double check to make sure we are answering the phones. That clearly is that is a gap that we need to fix, apparently. But I will tell you, those personnel are still at work. So again, this might have been a case of moving offices or something like that due to all the shuffle going on right now with some people teleworking and some people moving offices and things for COVID. But please take your forms in. I think it's your 2648, your DA 2648. Please take that form in, and those people stand ready to assist in Waller Hall. If you're not able to get through on the phone, just walk in. I guarantee those people are there and ready to help during business hours.
Yeah, and I'd also like to say that on the blue hash that is put out daily, we address the website for soldiers that are currently in counseling, SFL TAP counseling, or those who are going to enter. So they'll be able to get on that website, and what's supposed to happen is that they enter that website and enter their information, and then they're contacted, so we can do this counseling virtually, as well as a counselor calling the soldiers and airmen to take care of their needs and get us through the process during COVID.
Okay, next question is from Crystal. Says, will there be enforcement of the stay-at-home social distancing for those not complying? I guess my answer to that is yes. I expect the chain of command to enforce the orders that we issue. And again, this is personal responsibility for everybody and personal discipline, and then helping your buddy. As we've talked about, a lot of these things are new habits for all of us. And the expectation is that we all learn, correct each other, be examples to each other, and abide by these measures so that our community can get healthy and back to normal again. Okay, the next question is from Paul, and it says, why are commands so different in the manner they label someone mission essential? So I don't know the specifics. I know of what unit you're in right now to ask this question, but I can explain it with the varying units that I know, because again, we took a back brief on this, and we get briefed this every week on who's mission essential. The hospital is largely, it's all hands on deck. It's been all hands on deck. It's 24/7, going to shift work, and everybody's working. So that makes sense. They're mission essential in doing their duties. A lot more of our MPs are working. It's less than it would be normal because we don't have, our military police aren't out training, but we have more of our MPs that are mission essential right now because of gates, because we have MPs in front of commissaries, PXs, and other key facilities. We got them out in the hospital. We have our pilots, Army, and I'm sure Air Force have to do the same as far as maintaining proficiencies that we have to do, and so there's training related. We have pacing equipment that changes. We have phases that have to be done that we can do by social distancing. We have people that we just need to make sure that are around for good order and discipline that we always do with staff duties and everything else, and command and control. So it does vary by unit. It also varies based on what activities are coming and going. It's changed, like the 62nd Medical Brigade has been very, very busy and had more because they set the hospital up in Seattle. So I don't know your specific unit. I do know that some units probably have less than 5% of their units that are mission essential, and then others have many more. So it just depends, and I am counting, and what I'm tracking, that the commanders are doing a good job of understanding who should be mission essential and getting that information out. Next question's from Adriana. Would there be any problems having a PCM, primary care manager, renew a prescription for 6 months instead of 60 days?
Thank you for the question, Adriana. It depends on what that prescription is. Typically, they're not going to be a 6-month prescription, and this talks about specifically on inhalers. We do have a shortage on inhalers that we're only giving them out for 30 days at a time. That doesn't mean we don't have them. That just means we have a limited supply, and we want to make sure everyone that needs them gets them. And anyone has any particular medical condition for which they might need something else, we can always work that out too.
Thanks, Tom. Yeah. Okay, next question's from Mashi. Are soldiers in the barracks allowed to leave post to go hiking? Yes. Again, I didn't state that up front, but if you're going out to do physical activity, I mean, we get that. That's highly encouraged that you would go out and do physical things, maintaining, again, in line with the governor's stay at home, but stay healthy order and the general order that we're maintaining proper social distancing. Okay, next question is from Melanie. And it's, please update us on the CDC, Child Development Center.
Thank you, Melanie, for the question. So this could be in a vein of a couple different things. You might be asking about the positive case, the positive COVID case that we had. or you might be asking about maybe billing. If you don't mind, let me just kind of update you on both. We did have as most of you know, we had one positive care provider not a care provider, a person who set up the room in the Child Development Center, then left and never came in contact with any children, but out of an abundance of caution, we did quarantine some individuals that employee worked next to, and the kids that went into that room after that employee had left. Again, never any contact with children specifically, and we've actually gotten all those tests back from all those people who were quarantined, and none of them tested positive. They've all tested negative. In the meantime, we cleaned that room with Team Clean, this team that I've told you about over the past couple town halls, a dedicated team that goes in with cleaning supplies under the guidance of a preventive medicine doctor. They cleaned that room, cleaned every toy, every countertop, every floor tile to make it spotless, and then they let the room sit for several days. That room is now prepared for occupancy again. Because we do have a relatively low census right now, we are not using that room right now just because it is not required, but it has been perfectly cleaned and approved for reuse again when needed. If your question was in regards to any sort of billing or any of those things, let me tell you, if you are a Mission Essential, a letter has gone out, you may have already received it, that told people about the adjusted fees for Mission Essential people. And also talked about all the new preventive measures that we've put in place. We're screening at the fronts of the CDCs now. We're asking the questionnaires and doing temple touch thermometers or mouth thermometers for the adults to ensure that anybody coming in is safe. We also sent a letter out to non-Mission Essential people that were previously getting care, reminding you that your slot is still reserved, that you aren't being charged. However, if anybody does have any issues with billing, please call 966-2977. We will ensure that your bill is taken care of if you are not Mission Essential and not currently getting care. But again, your slot is still reserved. We also updated people on the fact that we've gone to no more than 10 per classroom, even in the school-age services, the older kids, just as a preventive measure. And right now we have the staffing we need to take care of your children. And I'll just give a real quick plug for those CDC and school-age services employees that are helping us out. Those ladies and gentlemen are doing outstanding work to watch our kids so we can come here to work for Mission Essential activities. And I want to say a huge thank you to them again. And if you want to join their team, please join their team. We do have some hiring shortages that we will need to do once we ramp up back to normal. We need more people, so please go on the MWR page. It's got links for the hiring fairs, and we'll bring you on.
Thanks,
Thanks, sir.
Next question's from Jessica. If hearing and optometry are unavailable, how are pilots supposed to clear for flight physicals?
Thanks for the question, Jessica. So AMC has issued guidance that extends flight physicals out for 90 days. So we'll have an additional 90 days to accomplish those, and we'll have an orderly process once we're able to start that up again.
You can't hold your hand up and ask how many fingers. That's not close enough.
No, sir.
Okay, next question is from Jonathan. How will it work for soldiers who are new and need to in-process?
All right, so soldiers are still arriving, or currently at JBLM, are being in-processed through Waller Hall, and we're getting in contact with the chain of command and with the in-processing team and the chain of command. They're going through the necessary processes and steps. It's limited right now just to get them in-processed into the base, into their unit, into medical, and then we're getting them to their unit and then slowly finishing that process. But you will be fully in-processed within the next 90 days.
Thanks, Sergeant Major. Next question is from Sean. Is it still safe to donate and give blood during COVID-19?
Sean, thank you for the question. Yes, it is, and we highly encourage you to. We do have that spot on our website where you can go and find out the times a day that are available. Basically, it's right now, it's Monday through Friday, still it's work day, and they will schedule you to come in for an appointment and give blood.
And we need
blood.
We need
so
blood
please,
donations.
Please do. Our blood donations have been fantastic, thanks to the unit, and a lot of promotional activities. If folks want to help, that's a great way to help. Thanks
Great
for coming.
way to help.
Yes,
Thank
sir.
you. Thanks, Tom. Don't go too far. Next question's from Nicole. Will my husband be able to be in the delivery room when the baby is born?
Nicole, thank you for the question. Right now, and I don't know what the timeline is on this, right? If it's tomorrow, yes, you're good. And that's the difficult thing is this is a very fluid situation. So if it does change and we do have an uptick, there could be a change right now, yes, with the caveat that if your husband does want to be there for that particular piece, which I'm assuming he does, he needs to pack some clothes because he will not be going anywhere. He'll be staying with us as an additional guest during that time, so you need to plan accordingly. Please talk to your attending physician to make sure they can kind of give you some expectations. Bring some extra clothes with you.
I guess we got the targeted town hall. I just want to make sure, just like you're saying, that we
We could talk
post
about
all
that
that.
piece
Yeah,
too.
talk about that, make sure we have kind of an info sheet on. I know it's changing and you guys are doing everything you can, but that'd be
Right.
great.
We have Dr. Grant. She's my chief of OB, planning on being a part of that.
Okay, great.
So
Thanks, Tom.
Yes, sir.
Don't go too far. This next question's from Shay. And the question is, my primary care provider is now closed. If I need medicine, do I need to drive to Madigan?
Okay. Thank you for the question, Shay. Your primary care, it does depend on a few things, because I can't really tell from this where your primary care provider was, or if you still have contact with them. There are a few things you can do. Your provider can put your prescriptions in. You could pick them up the drive-through, or you could pick them up at a local community pharmacy, or you could use eScripts. If your provider is closed to the point where they're like not answering the phone sort of thing, you can contact as well. We will link you up with someone who can pull your record, take a look at what you have in there, and do like the same thing that I just explained as if your provider could do that for you as well. So
Okay.
we do have ways of getting after that, so you don't
All
have to
right.
come in if you don't want to.
Thanks, Tom.
Yes, sir.
Next. Nope, this one, you're off the hook on this next one. Next question's from Jennifer. Says, why are civilian construction workers working on post and not off? I haven't been off post in like a month, so I couldn't tell you what's going on out there.
We're staying at home. We're staying healthy, sir. Then, Jennifer, thank you for the question. The reason we have construction ongoing on base is, if you listen to the governor's address, and we appreciate him saying this, is that if you're part of the military defense industrial base, that those activities will go on. And we need these construction projects to continue because these are for mission critical capabilities. We have several projects going on around base, both here and at YTC. So as you drive around, you'll see some. We're putting in new wash facilities for the aircraft as they fly around this salty air here. You know, mission critical to keep those aircraft flying. We're building new barracks. You know, we're building new facilities here to keep us safe, to give us shelter, and give us mission capabilities. So we are still planning on all of those construction workers still coming to JBLM and to Yakima Training Center.
And the expectation is that they're following all of our COVID
Right.
mitigation measures,
Right.
and that we do have people that actually look at this
Yeah.
and are aware of the projects as well.
Yeah,
Correct?
yes, sir. Yeah, thank you. Yeah, the contracting officers for these contracts and the CORs, the contracting officers' representatives for each of these contracts, are definitely monitoring to ensure that they're done safely and that they're done in accordance with all the regulations. Yes, sir.
Okay, come on back up here. Sky, I don't know the answer to this. I was going to take a guess, but the
Okay.
question is for Maria. How many people are allowed in the commissary at one time?
Thank you, Maria. Yeah. Okay, so this is something we've just put into place recently, and it's not in place all of the time. It is for when initial opening hours, the commissaries are letting in about 50 people. And there's not a strict number, and here's why. Essentially, it's up when we open the doors first thing in the morning, people are surging towards those high desired items. The toilet paper, the paper towels, the rice, the water. The things that we do are still on shortages. We still have some shortages because of national supply shortages. We are getting better, and the supplies are coming in even more. You know, you've heard me say this over the town halls. It's getting better little by little, week by week. We're seeing more and more steady shipments coming in. But for those high desired items, people are kind of flocking in and not, at times, not following the social distancing rules, so we're metering people in a little bit. Really, it's only during those critical opening hours and maybe a surge again in the evening hours when they resupply the shelves at different times during the day. But in general, please continue your patience. Please continue your acceptance of everyone else as we go through this process. I do see as we walk around to the commissaries and the exchanges, people are treating each other with great respect, and they're following these processes. So thank you.
Thanks, Guy. Okay, we got a couple of questions on schools. I'm gonna take a partial answer because Colonel Duncan and I were talking about this. Don't know who the first one's from. Says, do we have updates to school closings, K through 12? I'm tracking school is for the rest of the year. I think we're not good. We go to several schools here. We were just talking about this. We have updates. We have school liaisons, and this is exactly what Colonel Duncan's working to make sure we get information out. Go ahead,
Yeah.
Sky.
Good timing on the question. We actually, as the CG mentioned, we just discussed this. So thank you for the question. We're reaching out consistently to all of the school districts. We have 17 school districts that we send our kids out to typically on a daily basis. Obviously, they are all on hold right now across the entire state. Right now, they don't have an exact date of when they're going to resume school and if they're going to resume school. They have not officially canceled schools in Washington for the rest of the year, as some states have. They are definitely looking at it, though. Some things they have done. They have rescheduled college testing boards. If you have a senior that needs to college test, those are rescheduled for May and June. They are discussing by each school district, and we'll stay in touch with these, and we will probably do a focused town hall, the one that CG mentioned earlier. We'll probably do one of these on schools in the next few weeks. If you're interested in this, we'll put that time out for that, and you can tune in, and as we learn things, we'll put it out in that forum as well. They're continuing to send out virtual capabilities to the students in the school districts, and they are looking at what it will be for graduation requirements, again, for those graduating seniors. So your school district will be definitely the primary avenue of information flow on this, but we also want to make sure that we're giving you any information we can and tying together those 17 school districts. They might have individual answers to how this works, so please stay in touch with them and take your direct guidance from them. But we're helping to kind of stitch this together along with Kitsap and Whidbey Island and Fairchild over in Eastern Washington to get one holistic look at this for our military children.
Okay, so and I'm going to ask Colonel Duncan and the team. We have school liaisons that if we could have a button on our website or one place where we can go to get information on schools. We got a lot of soldiers and airmen out there that have kids in the local schools. We go to one place just to get all of that information. That would be great. So don't go anywhere. We got a related question from Emma. Can we get more school/educational resources for all the kids that are not in school? The district sends out packets, but a lot of people can't get to them. So sounds like
Emma, I appreciate the question. I'm not sure why you're not able to get to the packets. We need to check on that. If it's an internet capability thing or something, if you could reach out to our school liaison officer, we'll put this information on the webpage. So please check on the COVID Impacts webpage under home.army.mil/Lewis McCord, the main webpage. Go to the COVID Impacts, and we will put that button on that you just mentioned, sir, about schools, and we'll put the contact information about how to get a hold of our school liaison officers in there. And I'll have to check into why you're not able to get the capabilities that the school districts are sending out. Some are sending out physical packets, they're mailing them. Some are sending out virtual packets via email or their own web pages. Some of them have their own Blackboard capability. So let's check into that. And then now one more thing too, and how other capabilities that we can add in. Yes, on our webpage already right now, there are many other virtual capabilities that we offer that we've compiled a list of. There's probably 70 or 75 other capabilities on there. So please avail yourself of that. Please look at the webpage and you'll see resources there broken down by age, by category, by interest, lots of other things that we've collected over time. And if you have other ideas, let us know and we'll add those into the list if you have other things that you would see as a good thing that you can share with others.
Okay, next question is from Sean. Is there a restriction for how far we can go from base? The answer is yes. Restriction I've in place is 50 miles for a local leave policy. 50 miles, again, that we are all supposed to stay close. It's the stay at home, stay healthy order, and 50 miles is the restriction that we put in place. Next question's from Christy. Is there a goal response time through MHS Genesis? I sent a message on Monday, which is still unread.
Christy, thank you for the question. Yes, there is a goal response time. It's between 24 and 48 hours. I do not find this acceptable, however, so I'll tell you what we're going to do with your particular case. Hopefully you're still watching. 253-968-1145, option 4. That is my patient advocate. They check those messages constantly because they're teleworking and they feed you back. And also 968-1901, where you can call directly my PAO, because we'll hunt this down and figure out why that is, because we've got a lot of folks on the horn. It could be somebody PCS'd. It could be somebody got pulled for a mission, because we've got a lot of missions coming on here. But we need to be getting back with you, so I need to find out what's going on with your particular case. Thank you for bringing it to my attention.
Thanks, Tom. Next question's from Annabelle. Is the PCS ban still May 11th, or has it been extended? Right now, we have had no extension on this. It's still 11 May. And again, as I mentioned up front, I'll remind you how this gets started again. And given that we probably won't have moves for 45, 60 days, and how all this works, and movers coming back online, all the, the whole industry getting going, I think the schedules will be affected. That's my guess right now. It's kind of intuitive, but I think that will happen. But right now, no change to 11 May. If there is a change, you'll see it on the blue hash, which is posted on a daily basis, and we will also get that information out through your chain of command. Okay, I'm going to give this next question to Sergeant Major.
All right, before I answer this question, I just want to follow up on that PCS question that the boss just answered. There's actually like 3 categories. Right now, we have folks that are on PCS status that have shipped their household goods or shipped their POV, and there's ETPs in place that your chain of command is aware about, and they can send those up. There's the 11 May deadline, and then there's also soldiers that are on PCS orders that may not have shipped their household good yet, storage yet. And what we're asking you to do, if you'd like to stay at JBLM, is work through your chain of command on a 4187, and you can extend for up to 1 year on JBLM. I would tell you that if you are on recruiting or drill sergeant orders, that does not apply to you. All right, this question says, with the amount of new soldiers incoming to JBLM and those not able to PCS, what is the plan to provide those soldiers with barracks? Okay, so right now, I think this question was discussed earlier. Right now, we are not taking in any new soldiers in mass numbers from AIT or OSET. The Department of Army right now is working with the MACOMs, and there is a transportation plan. Right now, we're working on getting the soldiers who are currently on PCS orders, ETS, retiring, out of the installation in a timely fashion to make room in our barracks for new soldiers. The chain of command is aware of every barrack space we have, what our utilization plan, and we will make sure that when you do arrive that we have a bed for you.
Okay, next question is from Ashley, and Ashley's question, I am stuck in a halted PCS. What financial assistance can I access? And I do know that we have, so this is something we've been talking about, and why it's very important for your chain of command, for everyone's chain of command, to reach out specifically to you to find out where you're at and what your specific cases are. So we have made arrangements here at the IHG for the hotel, for families that are in the middle of the move. There are per diem allotments. And so, Ashley, I would ask again, I put out, I'm going to give you the hotline number here again for you to call. I don't have it memorized. And make sure that if you get in touch with us, and we will help you solve this problem. 253-967-3831. 253-967-3831, and you can answer your question to you directly. Okay, next question is from Dana. According to the Pentagon, civilians who are high risk are placed on admin leave, but civilians who become sick have to use their leave or leave without pay. Is this a mistake?
Sir, thank you, Dana, for the question. So this gets into the categories that this is another one of those areas that I understand was confusing there for a couple of weeks, but now we've gotten pretty clear guidance from Department of the Army, and Department of the Air Force is very similar. So the 3 categories in general that we are using during this time for civilian employees are liberal administrative leave, which has several other leave categories underneath it, but that covers people in COVID times. People that are impacted are not mission essential to be at base and may have been just sent home and put on a leave status. Your supervisor knows how to code that, and they should be telling you how to code that in your time card. That's liberal administrative leave. If you're teleworking, that means you're just simply not physically showing up to base, but you're obviously teleworking at your house. That's a whole different category. That's a regular telework status. And then third, the one that your question gets to is if you're sick, why still use sick leave? Sick leave is exactly that. It is if you are sick at any time of the year for any flu, cold, whatever. And so we do ask that civilians still use their sick leave if they are indeed sick. If you're quarantined, that was a different category, and please work with your supervisor for how to categorize that time. But if you're sick with, the flu or the regular flu or allergies or things like that, we do ask that you use your sick leave time because that is specifically what it is for.
I imagine that they can get all that information on the website through CPAC and
Yes, sir,
everything
and
else.
the
Yeah.
OPM website as well, the Office
Yeah.
of Personnel Management. Yes, sir.
Okay. Next question's from Tiandra. Can we use the golf course trails to run and walk? Yes. I was going to answer that one anyway, Colonel Duncan. Neva, will base security measures rise anytime soon? The answer to that is no. And I got Colonel Lomas in here, who's our Director of Emergency Service, and force protection is always conditions-based, and we always are taking a look at that regardless of the situation. Next question's from Marco. Can MPs be used to enforce social distancing? Answer to that is yes. The next question's from Milena. How can we work from home if we are considered mission essential but locked out of VPN? Okay, I don't know specifically where you're at with what that is. So we're actually one of the installations that we've done really good on this base as far as getting out and people using our virtual networks. I think we're one of the highest here in all of the continental United States, but we're still well below our capacity. And I think we still have the ability to do that.
Yeah, Milena, thank you for the question. We're talking that we're only at about 70%. Latest update I got is we're only at about 70% utilization of our VPN, which is way higher than it is on normal day business. It's only 10 or 20%, but in COVID times, a lot of teleworking, we're at about 70%. So please contact us and let us know why you might be locked out. Maybe there's an issue with your PC that we need to have one of the NEC employees look at. Thank you.
Okay, I'll take one more question, then I got a couple of comments here at the end. Do we have one more question? Is it a good one? Okay, last question is from Tara. And while I'm thinking about this question from Tara, I think that the other thing I would like to do is have a focused town hall, Colonel Duncan, on housing. It's been a while. I think it'd be a good idea to do that. We can have a virtual town hall. We've talked about that anyway. We've had a couple of questions here on housing. Be a good opportunity to do that. So stay tuned, everybody, for that if you have an interest in that. The question from Tara is, can Lincoln open up self-help?
Thank you, Tara, for the question. We will do that housing dedicated town hall, and we'll definitely have an answer for you then. I don't have an answer for you right now. So whether or not they can open up self-help, I will check, and we will get back with you.
Okay. Thanks, Guy. Okay, everybody knows we've been at this for a while. I want to thank everybody for your flexibility, for your personal discipline, which is so critical, and also for your efforts to remain socially connected. We may be increasing our physical distance right now, but we must remain socially connected. I expected all of us in the military to handle this crisis better than most. We know about hardships, and we're also blessed to have many great resources available to us here on JBLM that honestly most of the folks outside the gate just don't have. And I've been impressed with how this community's been doing it. And I've been visiting units, and I also know there's a genuine effort by your chain of command to help keep everyone informed. Thank you for joining us today. We'll see you again next Tuesday. As a reminder, we're going to go to once a week for these forums with us, and then we'll do several of the targeted sessions, several of the targeted virtual town halls. I hope everyone has a wonderful weekend. Thank Thank you.